Hello viewer! This video is presented by Group 4A as an output for their procedural skill in sensory vibration. Sit back, relax, and enjoy the presentation.
External vibrations are detected mostly by Pacinian corpuscles, even though Meissner's corpuscles can also detect low-frequency vibrations. Pacinian corpuscles lie immediately beneath the skin and deep in the fascial tissues of the body. They are stimulated by rapid local compression of the tissues because they adapt in few hundreds of a second. When the terminal fiber is deformed by compression of the corpuscles, ion channels open in the membrane which allows positively charged sodium ions to diffuse to the interior of the fiber, which then creates receptor potential, which then induces a local circuit flow that spreads along the nerve fiber. Therefore, they are particularly important for detecting tissue vibration or other rapid changes in the mechanical state of the tissues. They can have 30 to 70 meters per second transmission velocity.
Signals from the tactile receptors, Pacinian corpuscles, and Meissner's corpuscles will travel through the dorsal column medial lemniscal pathway. These signals enters through the spinal cord at the dorsal roots, where they separate into the medial and lateral branches. The medial branches will travel through the dorsal column and synapse at dorsal column nuclei, where second-order neurons decassate to the opposite side at the brainstem. These signals then continue upwards through the medial lemniscus and terminate at the ventrobasal complex of the thalamus, where third-order neurons allows these signals to reach the somatosensory cortex. Here are two figures that depicts the somatosensory cortex 1 and 2 and somatosensory association area. They are located behind the central fissure and are at the Brodmann's areas of the human cerebral cortex, specifically at 3, 1, and 2 for the somatosensory area 1, and areas 5, 7A, which constitute the somatosensory association area. The somatosensory cortex allows a person to localize different sensations at different parts of the body and also to judge the weight, shape, and texture of an object. The somato-association area allows for deciphering those sensory information of their deeper meanings.
Vibratory sensation or paresthesia is one of the sensory modalities of the DCML system. It is tested using a 128 Hz tuning fork and placing a vibrating instrument over a bone or bony prominence. By varying force of vibrations and comparing the patient to yourself, you can detect any deficits. You may also compare distal versus proximal and right versus left.
At this point, let us show you how to perform vibration test in the upper and lower limbs. The tool needed for the test for vibration is a tuning fork, and this is how it looks like. Can you see the Y-shaped instrument on the picture? That's the tuning fork. First, we have to introduce ourselves to the patient and then explain the procedure. Then, let her feel how the vibration of the tuning fork normally feels like and compare it to how it feels when